NSBRI wanted us to look at the case of, can we transport an ultrasound machine to the moon, not a big 500-pound one, but a small portable ultrasound machine. It could be made to be both a diagnostic and a therapeutic device, and it would be small enough to be carried to the moon or to Mars. It is one of the few technologies that can be miniaturized, and we want to translate the research that we've developed in the laboratory really into the clinic. And we call that translational therapeutic ultrasound.
Our goal is to be innovative in everything we do: patient care, research, education. And one of the ways we do it is just by putting things together that don't normally belong and finding ways to bridge them. Engineers and urologists is one example. Another is medicine and space. Interestingly, the military and warfare has often been a source of big leaps in medical care because of the unusual, intense nature of the requirements of military medicine. And I see an analogy here because NASA and space travel has this totally different set of environments and requirements for space travel that we normally don't think about. But we're trying to create technology for that environment, but then we bring it back into the medical environment.
Ultrasound is designed to find really small differences in very similar tissues, and kidney stones are very different from all the other tissues in the body. So it hasn't been harnessed in that way to try and show stones really well. The reflection off the front of the stone ends up making the stones look big. There's algorithms that the machines use that are great for seeing slight differences in tissue that sort of smooth the image, but they make stones look much bigger than they are. So we're working on trying to make specific algorithms so that it's exactly for kidney stones. So that's one of the big efforts, is detection and sizing. Then there's also, from a therapeutic standpoint, pushing stones and also breaking stones.
Kidney stones are so common in the emergency department, responsible for over 1 million visits a year, and 1 in 10 adult males can expect to develop a kidney stone over their lifetime. I see these patients when they come in the emergency department with acute obstruction causing pain, and it's excruciating pain. Ultrasonic propulsion is using a diagnostic ultrasound, but then adding a therapeutic edge where we would use the sound waves, or basically through processing, concentrate a focused beam onto a kidney stone to then move the kidney stone into a position that, from obstruction, away from obstruction, hopefully making the patient feel better. With a CAT scan, we can make a diagnosis, but with an ultrasound machine, not only can we make the diagnosis, but with the same machine, same probe, we could take that probe and reposition a stone through ultrasonic propulsion, either back into the kidney or out into the bladder, relieving their obstruction and eliminating their pain. There would be no need for additional pain medication. We would prevent things like hospital admission, and this has the additional benefit of adding cost savings or providing high value care in the emergency department. And I think NASA would have a particular interest in this because it means that astronauts, when they get kidney stones, we could push the stones back and they could go back to performing their critical work.
And what we discovered is some patients had a lot of fragments left over. They were small 1 millimeter stones, and we needed a system to kind of move a lot of these at the same time. And so our new probe almost goes back to where we started with 2 different transducers, but they're integrated together so that we get what we call a leaf blower effect, where we blow the 1 millimeter stones away in a large swath, but are still able to image with a conventional transducer.
The existing technology that's used for this right now is called shockwave lithotripsy. It's a procedure where a series of shockwaves are delivered into the body to break up a stone, but it's not always successful in a lot of cases. So only about 60 to 70% of treatments does it render the patient stone-free. So we think that this technology, which uses ultrasound pulses rather than shock waves to break apart stones, has many clinical advantages. Because it uses lower pressure amplitudes, it has the potential to avoid causing any sort of injury to the kidney compared to a high amplitude shock wave. Another benefit is that it can take advantage of existing ultrasound technology to miniaturize the size of transducers that we use to implement the therapy. This is an example of a burst wave lithotripsy system, including the electronics in this gray box, and then this small therapy probe, which houses an ultrasound imager in the center for ultrasound guidance. We're also developing a lot of techniques to do research on burst wave lithotripsy here in the lab at the Applied Physics Department. This is another example of a burst wave lithotripsy source that's considerably larger, but has the capabilities to deliver a large range of pressures and beam widths and different frequencies so that we can test the effects of these parameters on breaking up stones. So we think that using this sort of a research platform, we'll be able to identify what the best way of treating stones is, and then miniaturize it into something that's much smaller than what's used in the present clinics.
One of the examples of our predictions that if you want to push the stone is a good thing, but sometimes you need to grab the stone and to maybe to displace the stone in the direction you desire. And for that, we developed a new application of the ultrasound beams when we create so-called tractor beams. And the tractor beams, sometimes they are called also vortex beams. They have an acoustic field which has a structure of the hollow tube. And so if you place a stone inside this tube, you can not only push the stone, but also move it in the side direction, in any direction you want. It's still a kind of idea. We have some preliminary results in calculations and in experiments, and we believe that in the future we'll be able not only to push the stone, but also to levitate the stone and to move it in any direction, inside the kidney, inside the patient.
Well, they say that kidney stone pain may be worse than anything except childbirth, and even that's arguable. If we could do something that could circumvent that and maybe reduce the need for a surgical procedure, there's an example of innovation that reduces cost of care, improves the patient's experience, and something we never would have dreamed of 10 years ago.